Well, I teased this at the top of the show as well. And I asked Amanda if she was scared, excuse me, scared, I got the coronavirus, scared to go to the dentist. I don't have the coronavirus, by the way.
Okay, good.
Okay, if not, you should run. And she said no. And I said, well, you know what? I kind of do. Dr. Martin joining me now from Waco Dental to talk about getting over your fear of going to the dentist. Yes. You get this a lot, I'm sure.
Yeah, daily. I try to treat everybody like they're afraid of the dentist no matter what. So you might be the person like Amanda that loves coming to the dentist, but you also might be the person that's white-knuckling it and totally terrified.
Now, do they tell you that this is they haven't been to the dentist in a long time?
Usually the people that haven't been to the dentist in a while are kind of embarrassed about it. So sometimes they'll tell us and sometimes they won't. So it's kind of like you have to read people, but just, again, kind of like the golden rule of dentistry is just treat people how you want to be treated yourself.
There you go. So how do you get them started to relax? I mean, what are some of the techniques that you use to get somebody to kind of let their guard down and let you do what you do?
Well, I would say, first off, you know, we do like just a couple pages of paperwork for them to start off so they're not stressed about that. We have them sit in the massage chair in the waiting room.
Hang on a second. That would loosen me up big time.
Yeah, get a massage. Serious full-body shiatsu in the waiting room. Yeah.
That's brilliant.
It's great. It's great.
Because it does get people's mind off of going to the dentist.
Yeah.
Okay, so you got the paperwork at the massage chair.
Yeah.
Now, do you kind of find out what their needs are? I mean, someone like Amanda obviously goes to the dentist all the time, but someone that hasn't gone in a while, do you want to see if there's some plaque buildup, some cavities?
Yeah, so basically we'll bring them back and sometimes we'll just sit down and just find out what they want to accomplish. You know, do they want a nicer smile? Do they want, you know, do they have a tooth that's bothering them? What are their goals for their mouth? And yeah, we'll check them for plaque and for all those other things there. And the way we try to make them comfortable is we'll, you know, find out if they do have any dental fears. You know, what are those fears? And we can overcome all those different objections, because I myself didn't like going to the dentist when I was a kid. I still don't like doing it, and I'm a dentist right now. And I still don't like going sometimes. I mean, I shouldn't say that, but it's true.
No, well, I mean, it's a very personal thing.
Yes.
I mean, someone's in your mouth, right?
Yeah, yeah. We deal with two very intimate areas, your mouth and your pocketbook, and, you know.
Good point.
and so we have to be gentle in those areas.
Okay, you work with kids too, though, right?
Yeah.
So let's talk about that. I mean, how often should a parent, and if you're watching us right now and you're thinking to yourself that you haven't really brought your kid to the dentist in a long, long time, when do parents need to start?
I would say, you know, as early as 6 months, you can bring your child. So even before the first tooth, or as they're getting that first tooth, because it's good to discuss like good habits.
Okay.
You know.
Here's an question. I don't have any set list of questions here. I'm going to ask you straight up. I have both my wisdom teeth. Okay. Should I have those removed? I mean,
yeah. I'd probably have to just do an exam and see.
I know, but how often do you have an adult that's 50 plus that has their molars and wisdom? I mean,
I would say it's pretty common.
Really?
Yeah. Okay. Yeah. And so it really depends. Like if they're giving any kind of pressure or any pain to you, then for sure get them out. But yeah, I would have to look at them and see. You got to come by the office. I
got to come by and make an appointment. If you want to come by, like me, and make that appointment, the best way to do that is how?
You can give us a call at 254-754-3505, or you can find us at waco-dental.com. And I tell you what, one of the best things you can do is come in and just let us evaluate what you need. And there are certain ways to make it to where you're not so nervous and not uncomfortable, because we do have, like, I'll put a gel in the gums before I do any kind of numbing. I'll do the laughing gas, which is good.
I like
and
that.
Then on top of that, we do this technique where we put a vibration on your cheek before we put any numbing in.
Okay, so, I'm coming.
But all those different things together, it helps.
You had me at the massage chair, so you had me right there. All right, check that out at Waco Dental.